Patrick, thank you for that. And joining us right now to sort through some of this, nurse specialist Alice Benjamin. The new mask mandate comes just 1 month after California lifted all the COVID restrictions. Nurse Alice, given what we saw last week after the 4th of July, you talked about it here. You're not surprised by this, are you?
Absolutely not, Colleen. I mean, we actually saw this last year. During the holiday get-togethers, we always saw a spike in the number of infection rates. And that's actually what we're still seeing now. Because, as you know, we are still within 14 days of this July 4th weekend. So we had people traveling for the holiday. We know that we have the Delta variant, which is responsible for more than 60% of cases. We had relaxed capacity and mask restrictions. And people are out, as you can tell by the traffic. So it's not a surprise to me that we're seeing an increase in infection rates.
County Health says that the core of the problem here would be those that have not been fully vaccinated. As a health professional, do you have any idea what can be done to convince people to get vaccinated? We've offered cash. We've done just about everything you can possibly think of, save going around to individual homes and knocking on doors. You have any thoughts, ideas?
Right. So I think if I knew the answer to that, I'd be a rich woman. There are a lot of people who are still on the fence of the vaccine, still some hesitancy. For some people, it's not a no, it's a not yet. There's still some mistrust out there. There's some perceived lack of access. And, indeed, there is some lack of access. Some people can't take time off of work to go during banker's hours to get their vaccine, or they have childcare issues. There are several things at play here. And I think we need to really look at individual pockets and certain populations to see what is the main issue here and try to resolve that. I know these lotteries and these gifts sound really good, but when someone has their mindset on not getting the vaccine, I think it's going to take a little more than that. We need to develop a trust here in order to persuade them to do what is in the best interest for them, which we know is to get the vaccine, because this is indeed turned into a pandemic for the unvaccinated.
Nurse Alice, why does the new mandate then apply to people who've already been vaccinated? A lot of people asking that question. Why do they have to mask up again?
Well, Colleen, we don't have a way to verify who truly is vaccinated and who's not vaccinated. And, we've been talking about this a lot, but there are still some people who don't quite fully understand that to be fully vaccinated means you have completed your series and it's been at least 14 days. So there might be some misunderstanding about what's vaccinated, what's not vaccinated. And then also, I think for some people that mask is a scarlet letter. So if you're indoors and many people don't have that on, but you do, you might feel like a way that you have your mask on. So there might be some peer pressure to take that mask off and enjoy life, normalcy, as other people are doing it. But, at this point, it's best that we all mask up, as we know that if you're fully vaccinated, you're less likely to get infected or sick from the virus. But still, we want to make sure we are doing every single thing that we can do to prevent people from getting sick.
All right, nurse specialist Alice Benjamin, thank you so much for joining us tonight. Now, from the new mask mandate to rising transmission, a lot of new developments today in the pandemic. We will keep you posted here at NBCLA.com, where you can see all the local guidelines for your area.
We also have some breaking news in the cast.